As I mentioned earlier, that we are in this place strategically. We're operating in these critical zones, and we basically leverage our One Health strategy and research facilities, so our farm facilities, our laboratory facilities, as well as our technical facilities to drive sustainable change to address global health challenges. And it is a complex ecosystem, so it needs all of us to work together. So you have your district veterinary services, you've got the wildlife management, you've got the public health sector, and what have you. And of course, our aim is to integrate sustainable livestock management practices with wildlife conservation practices to enhance biodiversity, improve the environmental resilience, and eventually build resilient food production systems for communities that depend on it. And while I'm not going to talk much on this, a key area of interest is sort of addressing the wild meat value chains. And they, in sub-Saharan Africa, Asia, as well as sort of South America, the wild meat value chain communities depend on it. So if we want resilient food production systems, which are not risky, I think it's important for us to be in this space. I want to sort of just talk to you briefly about this slide. Now that you know what this ecosystem looks like, I want to shift your attention to some of the drivers of emerging threats. And in that first picture there, you can see there's habitat destruction. There's the clearing of natural habitats, which are pushing the wildlife closer to humans and livestock, increasing the contact for potential disease transmission. Then you've got sort of your wildlife trade system. And global wildlife trafficking is creating pathways for zoonotic pathogens to jump between species and continents, as we've seen. The next slide there is one of my favorite slides. Save the Giraffes were trying to they came to us and said, here's a picture of a giraffe where we've encroached in their lands. So there's the human encroachment, and they're trying to protect the giraffes because there's a lot of accidents that happen on the road. And unfortunately, I couldn't find that image. But basically, expanding human settlements and activities in the natural areas are leading more close interactions and potential disease exposure. We also have climate change. Rising temperatures and environmental changes are altering animal migration patterns and habitats, creating new hotspots for pathogen spillover, mainly in Africa and Asia. And then you've got intensive livestock production. As the demand for animal-sourced foods increases, there is a high density of animal farming that's going to increase. And with that comes amplification of pathogens within livestock populations and the risk of crossover disease of species transmission. And my favorite after COVID-19 was this increased human mobility. Global travel has accelerated the spread of pathogens, quickly transforming local outbreaks. And so it's interesting when we say that 75% of emerging infectious diseases are zoonotic, it really highlights the impact of these drivers and further validates the need for us to be in this space. Increased frequency of zoonotic spillovers in the recent decades. Starting in 1920 with HIV, and then from 1980 onwards, there's just been a rise. Each of these diseases listed is linked to specific animal hosts. So whether it's your bats, your birds, cattle, primates, it demonstrates this wide range of animal species involved in spillover and the need for us to really look at surveillance across these diverse animal populations. And spillovers are not limited to a specific region, but as I mentioned earlier, that a lot of the hotspots have been identified in Africa and Asia. And these events have provided lessons for pathogen detection, response, prevention strategies, and essentially, what can we learn to reduce pandemics in this space? There are many preparedness strategies at the wildlife-livestock interface. And what the thing that I want to basically share in this slide is that I think it's important that we discuss monitoring of both wildlife and livestock populations for emerging pathogens to detect spillover early enough. Because what normally happens is we're not responding until the outbreak has taken place. And there's so many tools now. We've got advanced genomic tools, tracking, to look at evolution of pathogens. And in turn, this sort of supports your control, prevention, and mitigation measures as far as sort of vaccination campaigns are concerned. There are also sort of like risk maps that can be identified where spillovers take place, again, allowing governments to have targeted interventions. And I'm going to, in my next couple of slides, I'm going to talk about a case study in a minute. But one of the key things I want to highlight here is that at any given time, I think the Quadripartite has put a lot of emphasis on what is in there. So we've got a lot of, we're constantly, as an organization, we're talking. As a quadripartite, we're constantly talking to the quadripartite with what of their frameworks, and so if we're able to get into some of their actionable policies, we always try and. So for the next couple of slides, I want to just share a case study with you, just sort of honing down on a specific disease. So ILRI scientists have been working to detect, control, and prevent RVF, Rift Valley fever outbreaks. And basically, Rift Valley fever is a mosquito-borne viral disease of livestock and humans, and infected mosquitoes feed on humans transmitting RVF. But these outbreaks are also associated with sort of persisting rainfalls and flooding. And this is a really good climate change disease to look at. And of course, it's got severe socioeconomic losses. And then if you look at the infographic, that sort of just basically shares with you the different animal hosts that are involved. But more so, if you look at that little news clip that was from 6 days ago, saying Rwanda steps up measure against RVF. And it's interesting because Rwanda is just kind of battling with Marburg, and yet they've got RVF. So it's a constant, it's like being on the treadmill. You constantly have to keep going at it. But here I want to share with you some of the things that we are doing is building the capacity of RVF, not only sort of community-based Rift Valley fever surveillance, but we're also looking at the technical staff being trained on diagnostics. Our teams have gone out into the communities, bringing awareness on community disease reporting. We worked with pastoralists, as well as the county district veterinary officers. What do case definitions of Rift Valley fever look like? And there's a co-creation. So it's not sort of like, I'm a scientist, this is what I found, but it's basically looking at them and asking them, what are you saying? What do you see? What are some of those symptoms that are coming from you? So we're sort of co-creating this environment. And of course, now with mobile phone technologies, we've got WhatsApp groups for reporting what this looks like and passing that information out rather quickly. Some of the technical staff are being trained on RVF. So recently, I would say recently, as in earlier this year, there was a RVF outbreak in Burundi. And we were fortunate that our teams were able to go to Burundi and support their technical staff on sort of training on RVF diagnostics. But in addition to sort of just the lab work and the awareness with the communities, one of the things that we are looking at, and I have not shared this today with you, is sort of looking at decision support tools for prevention and control. So through one of the One Health projects, they've created a decision support tool. And this tool is really interesting because it takes sort of a bottom-up approach. It uniquely combines sort of decision-making modules and information dissemination features for local targets. And when I meant like sort of bottom-up approach, it integrates these high-resolution environmental data and allows prediction accuracy. And what that will help with is, you're taking a lot more of the meteorological data, and after that, you look at the tool will support with sort of like what are the risk summaries, and align with decision makers, allowing for targeted support in a specific region. This tool has been piloted in Kenya, and there are plans underway to expand across the Horn of Africa. And then the initial stakeholder consultations have been done, and feedback is being sort of taken into consideration to improve the tool. Now, what I haven't showed here is one more thing, which was because I didn't want to, I was both short on time, but I wanted to be mindful, was that we're also, in the labs, we're also looking at sort of this viral evolution. How has Rift Valley fever virus changed over time? To look at changed over time, because remember, there's vaccine and vaccination campaigns that are coming through. And we also use sort of a gendered approach on, how do we convince communities to take up the vaccines that are gender sensitive. But again, we have a guru called Dr. Bernard Bett at Ailry, who is our RVF specialist, and he's more than happy to share anything. So if anyone wants more information, I'm happy to share that along as well. For the next couple of minutes, I want to take you through sort of the spotlight on surveillance and early warning systems. And again, like I said, we're always working with our partners, and we're working closely with the Quadripartite. And this is sort of a show and tell, and I'm not sure if we have our FAO and WOHA friends online, but basically the WOHA, the World Animal Health Organization, has a wildlife health framework. And this framework is a critical initiative that strengthens the surveillance and detection of health threats at that wildlife interface. And so sort of by promoting standardized surveillance systems and training local authorities, WOHA, of course, helps with building that infrastructure to monitor zoonotic diseases effectively. So systems are in place. And I think it's important that as countries, we're able to go back to these systems and have a chat with them if needed, to ensure that member states are, frequently looking at some of these frameworks that have been established. And of course, not only does this approach enhance pandemic preparedness, but then also contributes to sort of biodiversity conservation, and maintaining wildlife health is essential for these resilient ecosystems. And what was also very interesting is that they had a really cute graphic, and I wanted to share that here, was, the role of individuals as well as community surveillance reporting systems, like what is in place, what is my role as a citizen, and as a community, what can we do? And it's really neat because it's very stepwise and easy to follow. This is a new framework which I was involved in. So FAO has developed a strategic framework for early warning of animal health threats. It will be published in the first quarter of 2025. And the framework was sort of developed through a collaborative process with the expert advisory group. So a whole bunch of us got together, and inspired from the Sendai framework of disaster risk reduction, it provides sort of guidance on 4 main components of early warning systems. This is understanding and monitoring risks, surveillance for early detection, communication and information delivery, how timely and systematic that needs to be, and then sort of decision support during the interventions. And the goal of this framework was to support the countries in reviewing their current surveillance systems, to progressively strengthen the capacity for early warning of animal threats. Another big thing that has been there is the One Health high-level expert panel on preventing spillover. And I thought this was quite important to bring this as sort of a reminder, because one of the things that I think we often miss is we're always very reactive. And this calls for more of a proactive approach than a reactive approach. So pandemic prevention of pathogen spillover from animals needs to shift, and we need to shift that paradigm. And then prevention includes addressing the drivers, disease emergence, as we've talked about, what is happening in the climate, what are some of the anthropogenic factors, to reduce some of the risks to human infection, and informed by other actions such as constant biosurveillance in natural hosts, people, the environment. We do quite a lot of wastewater surveillance work here, and as well as collection of soil samples and water samples from abattoirs, just to understand basically what is happening, who is speaking to whom, and what more can be done. And with that, I've just got a couple of more slides, so I'm hoping I'm okay with time. But basically, I want to just share something here. Now, we are not involved in sort of the youth initiatives, but, when Dada asked that, we say something here, I thought it was important to share 2 things with you. through our One Health organization, we are trying to get involved, at least next year, a lot more in youth and amplifying some of the youth voices. But here I want to share with you, and I really hope that many of you are part of the Africa CDC Youth Pre-Conference. My understanding it's taking place on the 23rd and 24th. And it would be good to hear about how the youth can get involved in some of these voices. In 2022, they had a youth engagement for advancing sustainable health, security in Africa. And then in 2023, they carried out leadership for safe and healthier Africa. And so we are keen to speak to Africa CDC to see what we could do jointly next year. So please do keep that in mind, and hopefully something comes to fruition. The last thing I do want to share, and unlike my colleague yesterday, who said, who was basically, as Dowda said, the Bible of economics. I am not an economist, but what I do know is that it is clear that preventing future pandemics requires sustainable investments in spillover prevention. And we've seen, we threw out some numbers earlier, and the economic losses from COVID-19 pandemic were nearly 14 trillion in some of these estimates. But the prevention costs are ranging anywhere from 10 billion to 31 billion per year, and I'm sure it changes. But it makes you sort of think back and say, well, it makes sense, prevention is better than sort of a response. But I think there needs to be a little bit more advocacy on, we keep talking about One Health, but there doesn't seem to be sort of a One Health investment from the groups. But I do know that the World Bank and the Pandemic Preparedness Group have allocated some funds recently. So hopefully things are moving, but I don't know if they're moving fast enough. And with that, I want to just sort of close my slides to share some key takeaways. One, I hope that you are looking at the wildlife-livestock interface as a key ecosystem, which has implications for both animal health production systems, biosecurity, and our health implications. Surveillance tools are integral to prevent spillover, and the use of tools such as genomics, artificial intelligence, correlating those with like risk maps, continue to provide up-to-date information, allowing governments to support timely interventions. Again, invest in prevention, invest in One Health. I can't say that enough. And like I said, it would be really great if we could get the youth involved in some of these conversations. And thank you so much for your time and giving. Thanks, Dow.
Thank you so much, Dr. Ekta. Like I said, once again, we cannot thank you enough. Yeah, of course, people don't know what's happening in the background, but this wouldn't have been possible this year without you, and we really appreciate that so much. I'm speaking on behalf of the entire organizing committee. Thank you so much, and for delivering this. This is another Bible of wildlife livestock interface. There's so much of resources in it for us, and we really appreciate that. And yeah, we are definitely sure some of the participants we have to take advantage of all the things you shared. We have one question in the chat box, and then if there's any other person that wants to speak, you let us know, and we can allow you to unmute yourself. It's from a one L to testify. Let me bring it out again. All right. The person is saying, how can we address the environmental hotspots driving the occurrence of zoonotic diseases and AMR? Yeah, maybe you answer the one on zoonotic diseases, Dr. Leon.
Yeah, sorry, Dad, I don't see the question in the chat, so maybe it's come to you. So one of the things I do want to share is that we are working very closely with the UNEP as well now, and I think the best way is we're taking sort of like, we're working to take lake samples. So we've got like sort of your lake, your water, your river samples. We've got soil samples that we're analyzing. And basically we're trying to understand what's going on. And earlier in one of my slides, I did show sort of that for example, we have a research facility where there is no human encroachment. It's wildlife with livestock, which is interesting because we're looking at that ecosystem as a controlled ecosystem to look at what is going on as far as antimicrobial resistance is concerned. Who is speaking to whom? Are they shared? Is AMR also spilling over? And similarly, we're looking at the pathogens as well. in that space. So I would suggest that it might, depending on sort of what country you are in, reach out to us. It could very well be that we're part of some of these country initiatives, and we're happy to discuss that with you. Or alternatively, I know some of the governments are working together. I just want to take an opportunity to share two things here. We've got two projects. One is called Oreca and Cohesa. And the Cohesa project looks at working in operationalizing One Health in 12 countries in Eastern and Southern Africa, whereas Oreca works in 8 of those countries. And so chances are that we're in your countries doing research on something. And so we're happy to have that conversation forward to discuss that.
All right, yeah. So you have to come through me, okay? So you have to be nice with me if you want to reach Dr. Hector. So thank you very much. Yeah, if you have any question at all, or if you notice any other project in your country and you want to participate, you can let us know. So we reach out to Dr. Hector and she can help us facilitate that. Thank you very much, Dr. Hector. Any other questions? Does anybody want to unmute themselves and speak? That was a comprehensive presentation, I must say. Yeah, thank you very much. I mean, and what I wanted to contribute is it's also important that people start to look at this wildlife livestock interface, not just the wildlife human interface, because anytime you talk about zoonotic spillover, it's just the direct thing we look at, okay, from wild animals to human beings. There's also the intermediary sometimes, which is the livestock. And, at that point, it's already affecting people's livelihood because when there's a disease outbreak, before you know what it is, and for the most part, people involved in livestock production are in rural places where they don't have access to accurate diagnostics or quality healthcare services and products. So it's yeah, it's always tricky, and before you know it, they're already diving deep into poverty, and then to bring them out is a problem. Makes everything more complicated. Thank you very much, Dr. Ekta. Do we have any question in the chat box or anybody raising their hand? And yeah, we've removed all the AI people causing problems in the chat box. What we will do moving forward is not to allow AI plugin anymore in our meetings. So sorry for the inconvenience on this occasion. So yeah, if there's no question right now, you feel free to send us emails if you have anything for Dr. Hector, and then we'll relay it to her. And yeah, we'll also give you a response. And if you need to contact her directly, we'll make that happen. Thank you. So moving forward, well, we are packed for today, and then we'd like to go a bit faster. Yeah, she saved us 7 minutes. Thank you so much. So we'll proceed to have a short briefing, or do I say presentation, on the FAO's Community of Practice on return on investment for One Health. You can see we are well prepared. I mean, because this year we want to talk about how it makes economic sense. So we invited the FAO to come and have a short talk on how their community of practice on return on investment is doing right now. So the presentation will be done by is it Mr. or Dr. Yoeri Booijink? Did I slaughter the name?
Mr.
Go ahead.
Yeah, you see my screen?
Your name, is it Mr. Yoeri or Dr. Yoeri Booijink?
Mr. Yoeri, yeah.
Mr. Yoeri is a graduate in animal science and economics from Wageningen University. He serves as a One Health expert at CRAD, where he specializes in evaluating the return on investment of One Health initiatives and biosecurity implementations. Additionally, he's an active dairy farmer in Netherlands. I want some milk here, bringing practical insights to his work in the field. Yeah, I like that interface of real life and theory. So, Mr. Yoeri and Cyril are key collaborators on the community of practice along with the World Bank. And this is a collaboration of the Quadripartite to advance the One Health and support implementation of the One Health Plan of Action. That is essentially the aim of the community of practice. And let's hear from Mr. Yoeri what he has for us.
Yes, thank you, Dada. And also thank you, Ekta, for the wonderful presentation before. And a big thank you for the organization of this wonderful event and the opportunity for us to share our community of practice. And we're very happy to be here and to contribute and to show everyone a little bit around the community. I will first briefly introduce the community and then give you a very quick tour on our online landing page. And of course, I would like to invite you all to join our community and to be engaged. But before we get into it, we need to acknowledge our support. The FAO of the Community of Practice on Return on Investment of One Health is a FAO-led initiative powered by the Quadripartite as part of the One Health Joint Plan of Action. So each of the Quadripartite members has a focal group, as a focal point, which is a part of the steering group, which provides us with technical guidance on how to develop the evaluation of One Health investments. We do this together with core group collaborators like the World Bank and CIRAD. And of course, we need to mention the funding that makes it all possible from the Gates Foundation and the UK FCDO. With that being said, let's talk a little bit about the value of One Health. Of course, we are very happy to see that One Health is gaining momentum. More and more, we see the benefits of implementation of the One Health approach in integrated policy interventions, which helps us to meet or to fill gaps.
We can't hear you right now. Maybe something went wrong with your mic.
Is it better this way?
Yes, we can hear you now. All right, thank you.
Okay, yes, thank you. Did I capture until the last slide or?
Yes, you were just starting with the last slide when you went out.
Yeah. So a little bit on the value of One Health. More and more we see the benefits and they are acknowledged, and more we gain momentum. In the terms of developing policy, we see more and more of the benefits, and those are more acknowledged. So One Health is really more an option how to develop new policies and interventions, which is why we're here all today. So that's quite a nice development. But still, we have some challenges with implementation. Often we see a lack of political commitment. And of course, this is part due to the novelty of the concept. In a sense, doing One Health with cross-sectoral collaboration is doing something differently than what we're used to. So this leads to institutional barriers that we need to overcome. And it can be difficult to get enough support to justify the initial high investment cost. So if we talk about this value in economic terms, because we see all of these benefits and we're very happy that it's more and more acknowledged. But in terms of economic value, it's still hard to describe these benefits in economic metrics. If we look at the benefits like they're listed here, many of these are very difficult to quantify, very hard to put into a single metric which we can compare. Moreover, they are often non-monetary. So it's very hard to describe the economic value of the benefits that we reap from implementing the One Health approach. Which is the main question. What do we get when we invest in One Health? What is our actual return on investment? And in economics terms, this value is very important because from a health perspective, we all know that this integrated approach yields much benefit and makes often quite a lot of sense. But if we look at the way how we make decisions, how we invest, then economic information is crucial. I won't go all of the aspects that are listed on the slide, but all of these are supported by economic information, and therefore it's a challenge for all of us to get this economic information and to describe the value of the benefits and be able to compare implementing the One Health approach to, for instance, single sector interventions. This is very essential, for instance, to make resources available and to determine who will make resources available to implement this integrated approach. Now, of course, I've structured this presentation to show that the economic information is very relevant a QR code which directly links to the registration page, which of course I would like all of you to invite to take a look there and to be a part and to be engaged. Because the community of practice for the return on investment is all about building this evidence base on economic information, on the value of the One Health approach. We're trying to review and to synthesize this evidence base, but also critically look under which circumstances this economic evaluation is valid. So under which circumstances certain interventions are cost effective or most relevant, or for instance, if a single sectoral approach would be a better investment. But we need that type of information. We also try to provide support for those who want to evaluate the project, to guide them in how to not only conduct the economic evaluation, but also to share the results. And in the end, we hope to enhance this evidence base to further support decision-making and implementation of the One Health approach. Because in the end, this is why it's very important to share this information right. It's very interesting to do an economic evaluation on one of the projects. But as we see, the One Health work field is so wide and so much issues can be part of One Health. It can be very hard for those who seek information to find it at the right place, from AMR to biosecurity and specific diseases. A lot of work has been done, but if we want to justify investing in One Health, it can be quite hard to find the right information. And the community of practice is really about trying to get this information at the place where it matters most, and those who facilitate decision making. So we really want to create a platform where those who have the information and have the experience and the lessons learned can share that information with those who specifically seek it in an efficient way. Just to mention, the community of practice is part of the One Health Knowledge Nexus, which is a platform on the FAO service, on the FAO website, with multiple community of practices. This one is on return on investment, but we also have one on AMR and biosecurity, for instance. So I invite you to take a look at those as well, of course, provided that you'll start with the community of practice on the return on investment of One Health. A little bit about the community of practice. I will not go too much into this because we have limited time and a very interesting panel discussion later, which I would like to give as much time as possible as well. But we have over 200 members. We launched officially in November last year with quite a nice distribution from all of the perspectives and the work fields that they're working in. Of course, we could definitely benefit from more youth attendance and talented young professionals like yourself to come up with fresh ideas combined with the experience knowledge of a lot of more senior participants. A little bit about the activities. We've done quite a bit in terms of building the evidence base already with the systematic literature review and an international consultation survey. We're writing, which is currently on the review, a knowledge for investment product. We designed guidance for economic evaluation, which is more like a methodological framework. We're assembling case studies. Of course, we actively are trying to build a community and get people engaged. Currently, the training module on how to conduct economic evaluation, how to share the results effectively is being under construction. We like to share resources. And of course, we have our monthly webinar. And I'm very excited because I see a lot of potential in engagement of talented young professionals. Because One Health, as I said, it's essentially doing things differently than we're used to. This takes a lot of time. So it's very important to keep this momentum in One Health going. And that's with the younger generation. We play a crucial role in doing so. So I would very much invite many of you to join the community, to be engaged and to share and just to ask questions if there are things you want to know. And I'm planning on doing some young talent engagement in terms of activities. We're looking what we can do. But if you have any ideas on activities that we can organize, please feel free to contact me. I would be very happy to think about them. In terms of case studies, I won't go into depth about it because I also want to show the platform very quickly. But we assembled case studies and we designed a format on of all of the different topics within our work fields. how to present case studies in a way that is quite structured, that those who seek information can very quickly go through the case studies of the existing evidence, and look at the type of information if it's suitable for their specific circumstance. So this one is on a game theory exercise on rabies control in Africa. And what's quite interesting about this one, we held a webinar on it, so if you are interested, you can look back at this. But this exercise suggested that that if you implement the One Health approach, it would actually lead to the change of the dominant strategy compared to, for instance, single sector integrations. So just saying that there's a lot of potential on this work field, and by sharing it, we can actually get this information where it matters most, hopefully. This is my last slide, but I also like to show, can you still see my screen on the webpage?
Yes, we can still see your screen. Let's to the page.
Yeah. Okay, this webpage is a very brief introduction, a quick tour to the landing page. If you would screen the QR code, which I'll also share in the chat later, then you get on our online platform. Very quick introduction. It tells us who we are and what we do. On the right side, you see what's new, so the upcoming events like monthly webinars, but also new publications or the training module once it's launched. You can find on the right. Then below we have a section where you can go to what you're interested in. For instance, a database of all the participants, a discussion forum, a knowledge hub about information, the e-course when it's online, case studies, and for instance, meeting and events. These are all the previous webinars on topics that you might find of interest. If we select, like for instance, this one I hosted myself, which was on the rabies case studies. But what we're trying to aim for is to organize activities, but in the meantime, also keep the discussion and the dialogue going. And we are really striving for an active community that if you have any questions, it's not loading, I see. But if you have any questions in the meantime, that we can continue this dialogue without having structured webinars. So that would be definitely something we're striving for, and we can facilitate all the things around, but activity in the community is something that is dependent on the participants, and we are really hoping that we can get it going even more, and hopefully also with insight of young professionals and young talents like yourselves. And with that, I would like to, I hope I'm good on time, thank the organization. I thank all of you for the opportunity to share the community. And I genuinely hope that I see many of you joining, and then, for instance, the next webinar. So thanks a lot. And then I would like to hand back the floor. Thanks.
Oh, thank you so much, Mr. Yoeri. That was amazing. Yeah, I wouldn't expect anything short of that. But please, the link is already in the chat box. Please, try to join the community of practice and on return on investment for One Health, and yeah, be active. It's not just about joining. Please be an active member and participate. And like you said, if you have ideas on what you think can be done to engage youth more in the One Health space, especially with regards to investment in One Health, feel free to reach out. You can come through us, and we can make his contact available, or any contact that will be the right channel, and you can reach out to him and share your idea and discuss and see how you can make it happen. Thank you very much. The link is in the chat box. I can resend it if you want me to. In the meantime, if you have any questions for Mr. Yoeri, put it in the chat box or meet yourself and speak before we go into the panel discussion. Mr. Yoeri, thank you. That was very comprehensive. Thank you for introducing this. I saw a lot of opportunities in your presentation, and I'm sure that will be beneficial to our participants as well.
Thanks, Loda.
Yeah. All right, I'm resending the link now. Amira already sent it, but here it is. Okay. All right. Any Are you seeing the link? All right. Okay, so then we go into the panel discussion. To start with, I would like to thank Amira for her efforts in making this the presentation on the community of practice was through her. She was like, okay, we can do this, and we are up for it. Thank you so much. And yeah, good to see your face again after Cape Town. it's it's been a while.
Good
Yeah,
to see you too.
yeah.
And I'm interested because there's colleagues are doing great work in the COP, and I didn't want to miss the opportunity to as it's a mutual benefit, and it would be great if participant would join. And as my colleague Yoeri said, it's important that we have a representation of African youth. It's our perspective is valuable and is important. It matters.
Yes, okay. Thank you so much. Mr. Yuri, I have a quick question. Will it be possible for us to share um, about the community of practice on our social media channels? And we have close to 10,000 um, yeah, outreach strength on the media. And if it will be beneficial, mostly youth, so it will be beneficial for the COP to have it going out on all our channels. I'm very happy to do that and to basically just invite people to join if you don't mind.
Yes, thanks. That would be most welcome. And just like Amira said, the representation of African youth would be very valuable. So that would be most welcome. Thank you.
Oh, great. Thank you. So we'll work on that. We'll let you see the draft and the graphics before we release them. We understand when it comes to the international NGOs, there's a lot of considerations with privacy and representation of personnel and product. So we'll let you see whatever we want to put out before we put it out. Thank you.
Thank you. That would be perfect. Thanks a lot.
All right. So the panel discussion is going to be moderated by my colleague, Dr. Damilola Areo. And before we go, I'd like to introduce our um, panelists, we call them, but in this case, they are more than that. But let's start. The first person on the list is Dr. Amira Pior. Uh, the right, or I slaughtered the name. All right. Dr. Amira is a DVM, Doctor of Veterinary Medicine, just like myself, and she's currently working as a consultant at the World Health Organization in the One Health Initiative Unit within the Elder Population Division, specializing in the One Health approach with a focus on global health threats at the human-animal ecosystem interface. She works closely with the Quadripartite organizations, that's the FAO, the UNEP, WHO, and WOA, World Organization for Animal Health, on the science and evidence dimension to support the implementation of the One Agent Plan of Action. Our expertise includes policy-relevant scientific assessments. In her current role, she serves as part of the secretariat for the One Health I Live expert panel. I hope she's going to give us some insights from that end as well. The expert panel provides guidance on the One Health Joint Plan of Action implementation. So the panel plays a critical role in contributing to the way forward on international One Health initiatives. Probably we are part of that by now, or we hope to be. Our research background includes working on long-term modulation of lung immunity by element infections, examining their influence on the immune responses to viral infections. And she was presented in various scientific forums. Well, we met in Cape Town during the 8th World Wellness Congress in September. Our involvement in scientific and policy dialogues exemplifies a commitment to integrating scientific evidence into global health policy, particularly in the One Health approach. Additionally, she's passionate about community engagement in One Health. Well, one of the reasons she's here, and she's committed to advancing knowledge and collaboration in the field, which is one of the reasons she introduced us to the COP to be presented. Yeah, so she's going to be representing herself here. However, we have to make that clear. She's here in personal capacity and not representing any of the organizations mentioned above. Dr. Amir, thank you. You're welcome. And the second panelist will be Dr. Samuel Akpan. My boss. The name is already Nigerian. So he Dr. Sam, are you here? We would appreciate if the panelists can, turn on their video during the panel discussion. So he's a veterinary epidemiologist and infectious disease ecologist with a decade of work experience spanning across one at project management, field epidemiology, and research. His work focuses on solving global health challenges at the human-animal environment nexus. And join me to congratulate Dr. Sam. He is a winner of the 2024 FAO World Food Program Global One Health Prize, instituted to support youths with innovative solutions aimed at improving the health of all species globally. So please, you can type congratulations in the chat box. That's a big one, a global award. He has also received fellowships and grants such as the GIZ/Alliance Doctoral Fellowship, Early Recognition on Rapid Action in Zoonotic Emergency, the ERASE Research Support, the DU Fellowship of West African Institute of Public Health, amongst others. He is currently a doctoral fellow at the Institute of Genomic and Global Health, formerly ISGID in Nigeria, and a PhD candidate at Wageningen University and Research in the Netherlands. Well, as you can see, we have a very big fish in the ocean. Congratulations once again, Dr. Sam. And we
Thank you so much.
right. Oh, now you got that here. Thank you. And the third panelist is Dr. Frances Gerakti Dawson. A small story with Dr. Frances when we were in Cape Town. One arm of my tag broke, and she was like, "Well, I can allow this to happen. Come, let me fix it." The mom may well out. So, thank you very much, Dr. Frances, for being here. And Dr. Damilola, I'll hand over to you to handle the panel discussion. Panelists, please try to turn on your video during the discussion. Thank you.
Okay, thank you so much, Dr. Dauda. Good day, everyone. Thank you to my amazing panelists. Dauda has done a good job in introducing everyone. I'd like to apologize for my voice. I'm a little bit under the weather, so please let me know if you cannot hear me clearly. Before I proceed, Dauda, can you confirm that you can hear me?
Yes, we can hear you loud and clear.
Okay, great. So we'll go right into it. We know that this panel is going to be talking about reducing cost and increasing efficiency of the health sector in African countries through the One Health approach. And from the introduction, you can already tell that we have the right people to do justice to this discussion. So my first question will be going to Dr. Amira. It is common knowledge that the efficiency of the health sector is essential for its sustainability. However, there are a lot of challenges that hinder this efficiency and thereby escalate the cost of healthcare. So from your perspective, can you share with the audience what some of these challenges may be, especially as it pertains to the African context? Thank you. You have the floor.
Thank you. Thank you very much, Lola. First, I would like to thank you for this opportunity to speak in this critical topic, and also thank you for having me. I think, Dauda, thank you very much for presenting first the disclaimer. As you know, I'm not here to represent my employer, WHO, but to speak my personal view, and as I'm here on my personal capacity. So as we know, health systems across Africa are navigating an array of complex challenges, many of which are rooted in the interconnectedness of human, animal, and environmental health. A concept that we recognize as One Health. So while this holistic approach offers tremendous potential, there are significant challenges that limit its full realization, and also that increase the financial strain on our health systems, which impede its sustainability. So this question is multifaceted question, and so it's a bit challenging to address, as health systems differ from a country to another, and health systems issues are not all One Health issues, if I may say. So to stay within the topic of this event, I will address mostly the issues that can be addressed in a One Health approach. And they are either described to and or demonstrated in some cases to be cost efficient or allow a return on investment. The first issue that I would address, or maybe an area, I would say an area of improvement, because it's very important to know that these are areas of improvement where we can work better. So the first is, and one of the most promising ways to strengthen our health system, in my belief, is by improving cross-sectoral collaboration. As the One Health approach, you all know, emphasizes that human, animal, and environmental health are deeply interconnected. However, for these connections to translate into effective action, we need stronger data integration and collaborative frameworks, and that break down the silos that are very often known between sectors. So, for example, by establishing a centralized data systems and fostering regular cross-sectoral communication, we can better detect and address health threats as they emerge. There are tools like mobile health platforms that have already shown potential to enhance data collection, particularly in rural areas, and could play a role in creating responsive and unified health systems. It is also important to be able to adopt a coordinated approach between countries to address common threats, for which an let's say an intergovernmental coordinated response could be highly beneficial in addressing efficiently these health threats. And there are also very good examples of studies that were developed, including about rabies control objective in Africa, for example. Additionally, it is also important to introduce also public-private partnerships models. So the second point I would address is strengthening strengthening a preventive health investment. It's actually a very forward-looking approach that prioritizes the prevention over reaction, and that's a very, very important element, and that can be very cost efficient to invest in prevention. And it is also sustainable in terms of health system. So whether it's primary prevention or secondary prevention, of course, there are a few differences in the interpretation in terms of the prevention. So preventive health investments, for example, such as regular vaccination programs for animals, or improvement in water and sanitation, are the conservation of biodiversity, can yield long-term dividends by reducing the incidence of costly health crisis, because a health crisis is very, very costly, and in that way, prevention is essential. You have, for example, among many projects, for example, that study the cost effectiveness, there's the World Bank estimates that modest investment, even a modest investment in preventive measures can save billions annually by avoiding the heavy costs of reactive health interventions. In Africa, where our resources are often, depend, but can be limited, this proactive approach is particularly crucial. So fostering on preventive strategies enables us to mitigate health risks before they escalate, which in turn strengthens the resilience of our communities. Another,
Thank you.
sorry.
Okay, let me just give you 1 minute to time your point.
Oh, okay, sorry. So I will. Sorry, maybe I elaborated a lot on this. So, but for example, promoting ecosystem health and public health are also intertwined, especially in Africa, where the biodiversity is high, and many communities rely on natural ecosystems. So, investing in environmental ecosystem conservation is not just ecological concern, it is a public health imperative, and it represents preventive measures, as I said before, to reduce spillover risks, for example, at the human-animal environment interface. And this allows to reduce the need for reactive health response. Access to safe and nutritious foods are essential because it ensures proper nutrition helps prevent diseases linked to malnutrition, strengthen immune system, and reduces the prevalence of infections, amongst other things. It is also important to build a One Health workforce, and of course, addressing antimicrobial resistance is also one of the cost-effective ways. It is also important to be able to achieve a socioeconomic and socioeconomic equity and an equitable financing of these health systems. Community engagement is essential, as many community health-led initiatives often can lead to very positive outcomes. And one final point, to not take too much of the time, and it is very, very important, is the role of women in health. That is a critical element that strengthens our health system under a One Health framework, as women have a role not only in the workforce, but also as caregivers. And it is also a very, very important element in empowering women and supporting their involvement in health community initiatives are transformative strategies.
Thank you.
All right, thank you. Sorry, I tried to.
Thank you so much, Dr. Amira. So we'll go straight to Dr. Samuel. I think Amira has done a lot of justice in being proactive with the challenges. However, we know that in the African health sector, we have limited resources, so to speak. So Dr. Samuel, this question is directed to you. In just 3 minutes, can you speak to us about how we can leverage the One Health approach to optimize human and financial resources, especially to lower cost and improve efficiency in the sector? So Dr. Samuel, in 3 minutes, thank you.
Thank you very much. Can you hear me? Sorry, am I audible?
Oh, yes.
Yes, you are. Please go on.
Yeah. Did you say 3 minutes or 3 hours? Okay, thank you.
3 minutes, please. Thank
So,
you.
if I should do that in 3 minutes. So, first of all, I think Amira has already mentioned something, but I think the first thing to do to be able to maximize costs and save costs and make it cost efficient is by breaking down the silos. There are different sectors that we put together as one health. We say the animal, the human, and the environment, but there's also one that we frequently miss out, the plants. So there are four aspects actually, not three. But sometimes we talk the plants under the environmental aspect. So we have to break down those silos. If we are having an outbreak response, we should have the three dimensions at the same time. I'll take up a case study, for example, a case of, let's say, schistosomiasis, for example. If there is a schistosomiasis outbreak and in a particular area, and then we have a lot of, so instead of human medics going alone to just ensure that, they do human clinical examination and treatment, I think everyone should be involved. That way it saves costs. So a team goes in there with different professionals. You have the human clinical examination. You have the other environmental guys doing investigation of the water sources. You have, because schistosoma, I think the intermediate host is a snail, the water snail, Limnia tarantula. You have the veterinarians or animal scientists isolating those snails to be able to test. So everything becomes holistic so that it saves cost of having to do the same thing 3 times or overlapping duties just for an outbreak. Then another critical thing, I think this is a very controversial topic right now, but I think it's something that I need to say here. We need to merge or find a way to integrate our centers for disease control. We have the Africa Center for Disease Control, where we have like a unit of it that talks about AMR but I think we need to really merge them together. We cannot be having AUI-BAR, for example, that deals with animal resources, and then we have Africa CDC that concentrates on the human. So even where I come from in Nigeria, where we have the NCDC, we are now advocating for the formation of Nigeria Animal Disease Center for Animal Disease Control, which I think everything should be integrated together. So there should be regional and pest and disease outbreak preparedness plan together to be able to ensure that we save costs instead of doing things 2 times. So that's what I feel. I also I have 1 minute remaining. I think when we have cases of food scarcity or drought, we see that in African countries, when there is hunger or when there is scarcity of food, we open the food banks, the food grains for people, for sale to people and all of that. What about the animals? What about the feed companies? Because we need to look at health as an integrated thing. There is no silo. So let's break down those silos. So if we are opening the grain bank, the food bank for food supply to animals, we must also be able to open it for feed making companies, people that take care of livestock. So there has to be food for animals, there has to be food for humans, and there has to be manure and fertilizers for plants. So everything goes together, because one thing is wrong with the other. Let me just lay a little background. Leanne said it yesterday. In Kenya, during COVID-19, it cost Kenya $33,619 to treat one health worker that had COVID-19. In South Africa, the same thing. I think in Western Cape Town and in KwaZulu-Natal, it cost $34,226 to treat one person. But if these things are prevented at the source and with this integrated approach, I think it will be better. We will be better off. Over.
Thank you so much, Dr. Samuel. I was almost tempted to just let you keep talking because you are really hitting the nail on the head. I thank you for summarizing your points in good time, and I think you made very good points. We have been duplicating efforts by just, having everybody do their thing where they are, and I think it's really time for that integration. So we'll go straight to the next question. Francette, I will be directing this question to you as well and giving you 3 minutes as well. So now we want to get some sort of experience sharing. So your question will be, can you please share some examples of how the One Health approach has successfully reduced costs and improved efficiency in the health sectors globally? And we'd also like you to go a bit further and share your thoughts on how you think these models can be adapted for Africa. And beyond adaptation, what metrics you think should assess the cost effectiveness of this model. So over to you, Frances.
Thank you so much for the invitation to be here. I'm just going to say straight away that within 3 minutes, I can't answer all of those questions. So I will try to provide some pertinent examples that people are interested in. My background is as a veterinary epidemiologist with a master's in public health. I've worked previously for WHO in Beijing and Laos and Fiji. The last 5 years I was with Australia's Department of Foreign Affairs and Trade, managing their One Health program. And currently I've decided to do a PhD in valuing the One Health approach because I think there's still so much to learn here. So I'm grateful to be here as a guest speaker, but also as a student to hear from the fabulous other panelists. And I will go back to look at your previous speakers as well. I really wanted to stress what Samuel has said about that efficiency comes from doing things together. And, you know, definitely, you know, you've got a car that's going out, it might as well have everyone in it that needs to go, not two cars going out. The problem we run into is that sometimes one agency, such as the Ministry of Health, will have the money to respond, and actually agriculture won't have money to respond until it's declared an animal health emergency. So looking at policy that cover, you know, when you can access financing or how that is shared between the agencies is particularly important if we're going to have that efficiency of response. But I do think that often a One Health approach requires an increased initial investment for more effective outcomes and reduced costs at a later stage. It requires you to do things differently. And we've had great success, I think, in health systems. They've been strengthened worldwide by looking and solving what they can do in the most efficient way. One Health is asking for collaboration, which takes time and resources. So it's really most useful for the problems that we can't solve in a really efficient way through one ministry. And that's when it's most useful. So again, reiterate what was said earlier. It's not appropriate to invite everyone for every trip. And you need to be selective if you want that efficiency. Often what One Health interventions do is that it's a transfer of the intervention to an earlier stage so that we actually keep people out of hospital and out of the healthcare system. And that's where the savings are made. I'm going to give you a couple of examples now from what I've learned, a couple of Australian examples and another one from Fiji. So Hendra virus in Australia is a bat-borne virus that was transmitted from bats to horses to horse owners. 30 years ago, we had our first outbreak in Australia. It was an incredible response by our scientific agency, and they managed to produce, because the horse industry was the racehorse industry, very big industry, a powerful industry in Australia, they managed to produce a horse vaccination within 6 months. So transferring the death of humans then to, well, let's vaccinate horses to protect humans. Although, as we know, if you don't talk to the community that are impacted, the racehorse community very happy to vaccinate their horses, the pleasure horse community not so happy to vaccinate their horses, and the people that are most at risk now are the veterinarians who are going to see cases of neurological disease. There was a paper just recently released at the beginning of this year through Nature magazine, where they've actually mapped now over quite a number of years the changes in forest available for flying foxes, also the drought and climate impacts on flowering of the gum trees and the fruiting trees that the flying foxes prefer to eat, and how those the climate stress has pushed the flying foxes into more urbanized areas, which is where they've then been able to infect horses. And that's when we've had these, so we can now predict the regular outbreaks because it's very much an ecological problem. So ideally, we wouldn't just vaccinate horses to prevent it. Ideally, we would have more trees planted and stop removing the forests in southeast Queensland, which is still ongoing. There's still ongoing removal of forests, and plant more flowering trees so that we really take that prevention back further, so that the flying foxes aren't being forced with the increased temperatures that we know are going to happen anyway, but they have a wider area of natural resources and aren't being forced into more urban areas. A second example I want to give is more of a environmental instance. So, I mean, we can look at a lot of zoonotic diseases. As I've said, hendrovirus is one example of those. But I want to raise the example of the WISH Fiji program. And as one of the difficulties, so it's quite easy with hendrovirus to say, okay, we now can vaccinate the horses and we have many less cases of transmission to human health. So, you know, there's a clear cost saving there. In fact, the clear way to measure success. But when we look at the WISH Fiji program, which is Watershed Interventions for Systems Health, it's a really lovely program that takes a top of the mountain to the coral ocean view and looks at the watershed and protecting the waterways. It looks at what upstream is causing issues downstream, all the way to you know, are there animals encroaching on the creeks and so on? Is there human waste going into creeks? Is there being, you know, sand mining so that the creeks and the river systems are being impacted and are being soiled? Is there effluent going in? And what they found is they get a reduction in the villages along these rivers of typhoid and leptospirosis, even if there's flooding and typhoons and so on. And they're looking also to have impacts, to measure the impacts on the coral reef and then on the fisheries in the coral reef. So it's a very long-term program. The issue is that our health systems are set up in districts and in governance areas. They're not set up to allow for a watershed. So the only way they can measure is by going to the villages and asking for recall and who's been sick. They can't actually measure because our surveillance systems aren't designed to allow for a measurement at a watershed, because some people from this side of the river are going to that health centre, some are going to another health centre, and so measurement is difficult for environmental changes because of the way our surveillance systems are designed around political different governance type of areas. The last example I'm going to use, and I probably have taken up too much time already, but one more example, which, because I know that we tend to be quite happy thinking about One Health approaches for zoonotic diseases and infectious diseases. But another example from Australia is where they found there's a program through the Australian National University in Canberra called the Sustainable Farms Project. And what they're doing is planting tree lines and looking after dams on our farming landscape to encourage wildlife and reduce, like, you know, sort of nicer climate zones, so it's not just a bare empty paddocks. Encourage wildlife and bird life. They have better water maintenance within the landscape as well. And what they've actually found is that they have a reduced rate of mental health issues in the farmers that are involved with this program, because even if we have a drought and we have a scarcity of rain, the paddocks may be bare, but the tree lines are still full of life. There's bird life there, there's native animals, and while the dam might be fairly empty, we know that there's frogs still sitting in the mud waiting to come out when the next rains come. So, that aspect of people being really, aware of the stress and the pressure of the climate and absorbing that within themselves as well. So I think that's a really good indication. Just to note that suicides in males in our rural areas is one of the highest causes of death in those areas, and it's young men that commit suicide, a lot of it based on the pressures that they face, and I guess the lack of options that they feel they have when they're farming land that is drought-stricken and have animals dying around them. Any questions? Very happy to take on. I'm not sure if I covered everything there, but I tried my best. And if I've got any time left, please give it to Samuel.
Okay. Thank you. I think I can go straight to the next question. And since with you already, I would like you to take the question for 2 minutes. Then the same question will apply to Dr. Samuel and Dr. Amira as well. So just in 2 minutes now, how do you think African youths can become more involved in One Health initiatives to improve local health outcomes and decrease the dependence on expensive centralized healthcare? Just in 2 minutes.
Thanks so much. There are a number of programs that are happening within Africa that I think you need to chase and be aware of. The Nature for Health programs are really great and really innovative, and Africa will be leading there. I think looking at, again, Amira said earlier, wash interventions or water, sanitation, hygiene interventions in any community are going to provide, more and more. The basis of good health is there, and that's the basis of health prevention. I think also when we look at the learnings from the Wish Fiji program, it is protecting our water resources from having, but then again, that requires some resources for fencing and so on, and we don't want to have a burden transferred to, fenced animals if they have to be brought water and food and those sorts of things. So we need to be aware of who the burden is being transferred to. But also, again, vaccine programs and advocacy for addressing endemic animal and human diseases with vaccines is, again, another really good step towards, a One Health approach. There are a number of improvements that could be made to vaccines as well, making them heat stable, making them suitable for the African environment. I know it's been done with Newcastle vaccine. They're also looking at rabies vaccine now and actually measuring how heat stable it is, so that the pressures on refrigeration are not as important as they may seem at first. Thank you.
Thank you so much. Thank you so much, Frances. I would call up Dr. Amira. Please, can you speak to the question as well? Let me go again. So this is a youth platform, and we are always interested in knowing how youths can become more involved in One Health initiatives. So from your opinion, can you speak on how youths can become more involved in One Health initiatives, especially those that are targeted at improving local health outcomes and also decreasing the dependence on expensive and centralized healthcare? Please, in 2 minutes. Thank you.
Okay, yeah. So I'll just say probably just two that's on my mind. Number one, youth. Okay, when I talk about youth, I'm also talking about myself and you and every one of us out there. We should invest in enlarging our capacity, increasing our knowledge on One Health. Okay. Now that there is some inequity in assessing funds for health issues and all of that, we should be able to at least improve the reporting in such a way that the Africa CDC does not have to come into a village to be able to make a report. So a human medic should be able to know when an issue came from drought, for example, climate change. A vet should be able to recognize when there is bacterial wilting on a leaf. You may not be able to say, okay, this is specifically what it is, but some of those help in early reporting, because early reporting means action is going to be taken. So you cannot just stay on your lane and you do not know anything about the environment. You do not know anything about erosion. You don't know anything about, and all of that. And then youth should form cooperatives. I see this a lot in the University of Ilorin. I must applaud them. Student cooperatives and all of that, and student unions and all that do that a lot. So tree planting is some of those things that you can do. Now, these are not tangible things that you can link directly to One Health in terms of outcome, but is a ripple effect. So if you're organizing a birthday, instead of, or maybe an event, instead of saying, or probably you want to go to motherless babies home and all of that, we encourage you to also integrate One Health into your celebrations. You could say, I'm 35 years, I'm 32 years, I want to plant 32 trees, for example, in my school, in my home, in my environment. That goes a long way. So youth can form cooperatives and pool resources together for water, sanitation, and hygiene, waste recycling. You could collect plastics from resistance, residues in crops can be avoided, and even animal health becomes better, human health becomes better, and the environment becomes better. Now, these are little things to be done that does not require money, but in the long run, it can actually go a long way. So if you forget anything from this, what I said, the number one thing we need to do as youth right now is to increase our knowledge base to ensure that we know a little of plant health, a little of animal health, a little of medical, and to be able to make these reports as we are doing social media posts. When we see issues in the human medical aspect, when we see issues in plants, we should be able to also talk about it, that we see entered a tomato farm and everything was wilted. That's a report that can actually bring about interventions. Sometimes